Hi everyone, and welcome to Module 8. So in this module, we're going to review everything that we've been working on, and we're going to get into helping you really generalize these skills that you've been learning, all right? So at this point, just want to check in and ask, how are you doing? How's your voice? Are you practicing your mindful voice? Are you practicing your vocal function exercises? Are you integrating the resonance, the pitch, the intonation? Last week we talked about articulation, body language. How is this all coming together to shape your overall feminine communication? If you have any questions or feedback, as always, I'm going to direct you to that Facebook group, social media, email. Get in touch with us. We love to connect with our clients and to give feedback and guidance because we want you to be successful, all right? So we've been moving through these series starting with the vocal function exercises, but at this point I'm going to say that you've been working really hard. It's week 8 and that you're very familiar. So go ahead, pause the video and warm up with the vocal function exercises. All right. And now getting into the resonant voice work, as always, we're cycling through that hierarchy where we're starting with our hum, focusing on the M and the N sounds, and building the consonant to the vowel, moving through the A, E, I, O, and U. Using your word list, I want you to move through the single syllable words, then the multi-syllable words, into the orally resonant words, into the phrases, the sentences, and hopefully the conversational speech. Once you've reviewed that hierarchy a few times, I want you to start incorporating the pitch into it using that pitch app. Where are you at this week? What notes are you getting really easily? And what notes are the sticky points? Or have you found that voice that feels really good and you want to just like go through those word lists and the, phrases and the dialogues using that pitch? Yeah. Intonation, doing the dialogue work, reading a monologue or a dialogue with someone or a paragraph out of a book or a movie script is a great opportunity to keep plugging away at intonation because it's a little bit more natural. Yeah. So move through that and apply and use the strategies we talked about last week, the articulation points and the body language points. Integrate that in, especially at this point. It's less and less structured work and more finding opportunities for natural interactions to happen and kind of gleaning feedback from the way that the world responds to you, okay? So if you think about it from that perspective, it's gonna be easier for you to go out and, in a drive-through order a cup of coffee and never give your name out because you want to see what the response is. The way I like to measure this is I say 10 opportunities, okay? List 10 phone numbers of businesses that you want to cold call. Don't give your number. Kind of get a little bit feisty maybe on the phone. Do something that would evoke the response of like, ma'am, you need to calm down. Okay? So make a list of 10 businesses, call them, don't give them your name, get a little snarky, and check off each one. Did I get called ma'am? Did I not get any response, which can be as good? Or was I misgendered? All right? And what I would like to see is at least 80% of the time you're getting gendered correctly. Okay? That's a great technique because now you're looking for that 80% progress. Okay, this is where we're really making progress.
It's also an intonation practice, right? So you're getting a little feisty.
Yeah. And just gamify it for yourself. Think of it as like, this is an exercise. I'm doing this really intentionally to see what strategies are working and what's not working, okay? So you want to do this and then take notes. This is not like something that should be boring or not fun. It should be like, oh, this is funny. It's kind of like when we used to prank call as kids and, we'd call 411 and, ask for the number to Circuit City and then they'd be like, okay, what city? And we'd be like, Circuit City.
Circuit?
Yeah. So think of it as like a crank call. Those were the good old days.
Oh my God.
what are kids missing nowadays?
Yeah.
So yeah, having conversations with your trusted conversation partners is a great tip for generalizing. If you go to any sort of support group or a meetup, or if you have a therapist or other clinician that you work with, short scripted dialogues between a client and a clinician or is what I would usually do. So we're going to actually demonstrate that for you here in a minute. Role playing with a conversational partner, the phone calls. How are you doing when you speak in really noisy environments? How does your voice hold up? What about laughing in a feminine way? Coughing in a feminine way? I know it sounds silly, but like once you get to a level where you're like, I think I'm doing pretty good, you want to start challenging yourself. So learning to cough or sneeze, that's a little bit weird, but you know, if you want to challenge yourself, if you're up for it, you know, sniff some pepper. I'm totally kidding. Don't do that. Sniff pepper. Throat clearing, interjections like like those types of things. Those are the sort of things you want to start paying attention to. So Selena and I are going to go through a dialogue. We've got a little laptop down here, so don't mind us looking down, but we're going to go through a dialogue. I like to use this one website called Monologue Blogger. They've got a lot of scripts in there, and they're pretty humorous. No offense to Monologue Blogger. But we're going to do one called Enough is Enough. It is between two females, and Sarah confronts the nurse that has been wrongfully caring for her mother in the nursing home. Okay? So we're just going to go... Enough is enough. So we're just going to go through this together just so you can see, like, you know, just like have fun with this. Okay? Do you want to be Sarah? Because I feel like you're really good at being Sarah.
All
and
right.
I'll be the nurse who is wrongfully caring for your mother.
Okay.
All right.
Hi, I was hoping to have a word with you.
In a minute.
Miss, this is in regards to my mother.
I heard you.
How long?
Who's your mother?
You know my mother, room 405.
What can I help you with?
I would like to speak with you with regards to my mother.
Yes, I think you've said that. Go on.
My mother has a bruise on her arm.
That's from the injections. Sometimes there's a bruise reaction.
And my mother said you were rough with her.
Your mother doesn't make it very easy for me to do my job. When I gave her this morning's injection, she wouldn't allow me to do it. So she resisted.
And why do you think?
Why do I think what?
Why do you think my mother resisted?
I'm not sure.
Oh no? She resisted because you grabbed her arm like a savage.
Now, I don't know what you...
Listen to me right now because I'm trying to stay very calm. My mother was in a deep sleep and you started by grabbing her arm like a savage so much that you yanked her awake and she was frightened. Then you forced her to take her injection. She has bruises on her arm from your fingers, not just the injection.
She needs to take her injection. It's life or death if she doesn't.
Hey, let me be real clear about this. If you ever lay a finger on my mother ever again, I will beat your face in.
It's very aggressive.
Got it?
I'm scared.
I'm gonna go tell. Oh my gosh. If you ever touch my mother, so help me God, you won't know what hit you. You're a disgrace. The way you handle your patients, absolutely disgrace. You should be ashamed of yourself. She's a tiny little thing. You're 3 times her size. And handles her in such a manner you should be fired. She's not the only one. There are other patients here that complain, but they don't have family to defend them. I'm going to report you and make sure you stay far away from my mother. You are not to care for her or go near her. Understood?
But she needs her injection.
Don't be a wise ass. This is perfect. This is really fun.
This is a great script.
Any other grad students talk to their instructors like this? It's abusive behavior and intolerable. You have no idea what grounds you're stepping on here, and someone like you shouldn't care for the elderly. I'm always nice to you, and you always have your bitch face and attitude on. You've taken my kindness for weakness. You've seen my other side. Take this as a warning, Linda, or whatever your name is. You've been warned, and you will be reported. Someone else will take care of my mother, give her the injection she needs, the right way. We clear?
Yeah, but I did nothing but my job.
You can play your little game. I have pictures and I've been screening you. You think I would allow someone like you to hurt my mother? That's as far as you go.
Go ahead and put in your report. I have patients that love me, and my staff knows the truth.
I see. I'm going to get you fired.
You can't fire me.
Because you've been here for 20 years? You think you have seniority? You don't know who I am, who I know. Oh, who I am and who I know. You've been abusing patients for years, and it's come to an end. Enough is enough.
Do what you have to do.
Oh, we will. We most certainly will. If you have to take my mother out of this facility to a safer place, so be it. But you are not to touch her or go near her. So help you God.
All right, well, Selena, you should win an Emmy for that performance.
Oh, gosh. Never knew this was my skill here.
Yes, it's your forte.
Yeah.
Well, the idea here is to just demonstrate how to have fun with this. You know, we've said this multiple times throughout this series where voice therapy is silly, it's fun, and when you're in the mode of practice, get somebody there in the room with you that you trust and move through dialogues like this. It's just a way for you to practice, and you know, as you do these things, record yourself, play it back, watch yourself, watch your gestures, watch your articulation, and listen for the parts where you're doing really good and find the sticky bits. That's where we want to dig into, because we want this to basically permeate all areas of life and all parameters of speech and language.
Well,
so that,
and I think that this is a good idea too, especially this particular passage, because there's a lot of anger in it. So I think a lot of the practice so far has been very easy, nice, and you know, trying to move through it. It's like, how will your voice do in a situation like this? You know, so practicing kind of those different emotions with your voice too. Where does it go? How do you see yourself? You know, and with the recordings, what will it look like? You know? So
that's perfect. I love the way that you put that, because therapy tends to be very sterile, so to speak, right? And we're always having pleasant interactions. This is an opportunity to get into all the other emotions that we have, because we're not always just reading passages and, you know, phrases that are like, I like to go to the beach. It's like, no, this is, you know, trying to emulate real life. Yeah, and the more you do this, the more in real life you can actually feel confident projecting out with the voice that you've been working on. So I hope this makes sense. In the next, I believe we have 2 more modules left. Again, we're going to just demonstrate different ways to get real with the voice therapy, and hopefully keep pushing you to progress and really dig into your, you know, areas that you want to really work on. So thanks for joining us, and we'll see you next time.